Thanks for staying with us on The Real Story. Our next guest is Bristol Health CEO and President, Kurt Barwis. And Kurt, you have just gone through quite the ordeal right now. You actually came down with coronavirus while you were in the middle of handling this crisis and trying to also make sure hospital operations were up and running. You are feeling much better and you don't have coronavirus anymore. Tell us how you're feeling right now.
I feel absolutely great. I feel like I could go out and run a marathon, I think, but that's probably not true. But I feel great. Thanks, Jen.
What was this experience like for you? I mean, did you have mild symptoms? Did you get really sick? Take us through it.
Sure. I mean, March 27th, I got home from work that night, and I started to, it really started to feel like flu symptoms, and I got the chills. I had a really, really bad headache. I was one of those people that never had any kind of a fever whatsoever, and achy all over. So really just flu-like symptoms, and just felt like, terrible.
When you started feeling those symptoms, did you sit back and say, do I have COVID-19?
No, I went through denial. I started to take some cough medicine, and some Advil cold or something like that, and did that for the weekend, thinking that there's no way I had COVID-19. This is just a cold, and so I did that for Saturday and Sunday, and then Sunday night I was just sitting on the couch and thinking to myself, this is not right. I never really get a headache like that. So I called Dr. Lim, who's the director of our ER, and we talked through my symptoms. And it was pretty clear to me, there's no way I was going to walk back in the hospital at that point without getting tested. So he wrote the order. I came through the testing line on the drive-through testing, and we had just started our relationship with Jackson Labs. So my test was one of the first ones to go there. So of course that was when they were just coming online, and the turnaround time was amazing, and probably still is. But I had my results at night, just by chance that we had started that relationship with Jackson. Otherwise it would have been shipped out somewhere else. So positive on Monday, felt bad on Friday all weekend long, and positive on Monday. And then quarantined myself for my wife and lived on the second floor while she lived on the first floor.
My goodness, I'm sure that was not an easy experience by any means. And you sat there for 2 weeks or the 14 days? Is that what you did?
So actually the CDC changed the guidelines as right in the middle of me being out. And initially I had thought it was going to be 14 days and 2 negative tests. And actually they count the 14 days from what they call kind of ground zero, which would be a couple days before you actually had your first symptoms. But the guidelines changed, and I think partially CDC changed it because of the shortage of the testing kits, and also their experience. So I actually could return to work on April 7th. And actually I waited a couple more days just to be 100% sure. So it wasn't a full 14 days.
And you're actually going to be part of this antibody testing, right? This coming week. Tell us about that.
Yeah, sure. So it's really kind of funny. Dr. Eady, who's the president of Trinity New England, called me several times to check on me. And then one morning, I think he called me about 5:30. And said, listen, we're going to start our clinical trials. We're going to do the plasma for our patients. Can I sign you up? And at that point, there was no way I was going to say no. And so I signed up. I'm going over to St. Francis on Monday, and Monday around lunchtime, and I'll be donating my plasma. And that process is kind of interesting. They test you again for COVID. And then they also test your blood, obviously, after they draw it for the antibodies. So I'm really, really looking forward to that. There's been a lot of success in using that plasma with the antibodies to help patients who aren't really doing very well that are on ventilators. So I'm excited that maybe I can, as a result of this, give back.
Absolutely. How's the hospital doing right now? How are your workers? Do you have enough PPE at this point?
So the real shortage right now is gowns, and we had 300 reusable gowns delivered today. You can imagine we're going to go back to washing gowns, and so we're, that's the only struggle. We have plenty of masks and other PPE. We have a daily count. We count individual counts. We've seen incredible donations from the community. Construction companies and manufacturing companies have all chipped together and delivered PPE, and I think that's true for just about every hospital in Connecticut. This is an amazing community, and by the way, I just want to say, thank you to all the healthcare heroes, the folks on the front line, the first responders, the police, the fire, the EMS. They're just doing an incredible job. And a special recognition last week was National Lab Worker Week. And if you think about everything they were doing last week and before that, really helping us diagnose folks with COVID and working extra time to keep those tests going. It's just amazing what they do. So special recognition to all the laboratory workers.
I think, and I know many of us share the same sentiments that you do about our frontline healthcare workers and the amazing job they're doing, putting their lives on the line here to keep all of us safe. I want to go back to the gowns real quick, and we only have a minute left. Do you think the state's doing enough to make sure that hospitals like Bristol have enough PPE? I mean, the gowns, you got a shipment in, but how long is that going to last you?
So I think as of this morning, we probably had about 7 or 8 days for gowns. Just understand that a COVID patient that tests positive that's in your hospital, you're gonna burn through about 25 disposable gowns in a day. We've actually working on some other procedures to use gowns over again by hanging them up and taking them off and on a certain way. And in terms of the state, I think the state has been doing an incredible job. I think the administration has been right out there. The governor has been incredibly engaged with the hospitals. The Hospital Association participated in our one of our weekly calls. The access is incredible. I was looking for testing kits yesterday, and Secretary of State called me personally to help me through that. And I can't say enough about the collaboration that we have amongst each other and with the administration and all of the departments, including, I'll tell you, our local administration, my mayor, the local police. Actually, the police chief called me while I was out, and because he knew my wife and I were both, homebound, and offered to go get medications for me. So, it's really an amazing community that we have here in Connecticut.
Kurt, thank you so much. I'm glad you're feeling better and that you're able to get back to work, because I know the hospital certainly needs you as we still navigate through all of this. And a big thank you to all of your employees who are out there keeping us safe.
Thank you, Jen, and thanks to Fox 61 for really doing a great job covering this and bringing the story to the people. So thank you.
Appreciate it. All right, that's going to do it for this edition of The Real Story. We'll be here for you again next week. And remember, if you didn't get to fully watch the last 2 segments, or you want to watch them again or share them on social media, you can go to fox61.com. Have a great morning, and again, we'll see you next week.